Hi everyone, myself Dr. Shashidharan. I'm a consultant pediatrician and general physician. So today we'll have a discussion on talk on diabetes. But today is a twist is that today we are going to talk about diabetes in children's. Okay, so diabetes in children we label it as type 1 diabetes because in type 2 diabetes, which is more common in adult, where the problem is there is an insulin resistant, but the insulin production will be there. Unlike in children's, in type 1 diabetes, the main cause is that children lack the production of insulin. Why it is? What is the reason for absence of insulin in children leading to type 1 diabetes? The main reason is that there is an autoimmune, we'll call it as autoimmune, means the own body cells are getting destructed by our own antibodies. The main reason is that there is a molecular mimicry due to any viral infection, post-viral infection. There is a destruction in the beta islet cells of the pancreas, which produces usually the insulin. But in children, due to these autoimmune factors, the beta cells of the pancreas are getting destroyed early, so that the children are lacking the production of insulin, leading to type 1 diabetes in children. Yeah, sir. You have told me what is the cause for type 1 diabetes in children, but how do we diagnose for our children? How do you find that our children is having type 1 diabetes? For that, I'm going to tell you few key things where you can able to identify whether your kids is having type 1 diabetes or any symptoms related to type 1 diabetes. First thing is that the child will be very thin. Okay, the reason for their thin is inadequate weight gain because they will have an polyuria, they will have an frequent urination. They are able to urinate like from morning to night, in the midnight also multiple times. They will wake up you and they'll ask they want to avoid urination. It will be around some 10 to 15 times urination per day. So polyuria, polyphagia, they'll eat a lot but they don't gain a weight. Okay, that is due to more amount of sugar in the blood but not utilized by the cells. That is called polyphagia. Then polydipsia, they will have a lot of thirst, they drink, they pass urination, they drink, they pass urination. So these are the more commonest presentation of the type 1 diabetes in children. As I said you, polyuria, polyphagia, polydipsia. Yeah sir, you are told the symptoms also. How do we diagnose, how do we able to interpret that our child is having type 1 diabetes? Is there any easy way to diagnose? It is very easy step because you all need to know is a random blood sugar level. Okay, when you check random blood sugar level, when your children are having all this classical presentation, you can check a random blood sugar level. If it is more than 200, so you may need to consult a pediatrician. Your child might be having a type 1 diabetes also. So for that, so there are multiple presentation of type 1 diabetes. One is very asymptomatic. As I said, you will have all the symptoms, and when you check the random blood sugar level, it will be more than 200 mg per deciliter. So that comes in one way. Other way is that many parents are ignorant, they are not able to diagnose it, and the child will present with diabetic ketoacidosis, very bad state where the child will be very sick, acidotic breathing, and there will be lack of insulin in the body. That is an emergency state that I won't discuss here. But the most common state is many times they will come asymptomatically. With the symptoms you come, we do a random blood sugar will be more than 200. So how do we proceed, sir? If the random blood sugar is more than 200, you have to look for HbA1c level. That is a titer of 3 months the level of sugar in your blood. After that, if it is more than 6.5, your child might be in type 1 diabetes. We may have to label him as a type 1 diabetes, and we need to start him on insulin analog. Why sir insulin analog? Can we go ahead with some medication like adults are having metformin, lot of medications adults are getting tablets. Why my kid want to have an insulin injection? Is it good for my kid? You may have a lot of doubts, but from my side I want to say you, based on scientific evidence, type 1 diabetes, there is no insulin production in the body. Unlike in a type 2, where there is an insulin production is there, but there isn't resistance. So while coming to the type 1 diabetes, we have to start on insulin analog. As I'm mentioning, there are a lot of insulin analogs are there. Short acting, ultra short acting, intermediate acting, long acting. So your child may need to get admitted, and after that we need to titrate the blood levels of the sugar with an basal insulin along with that intermediate acting or an short acting insulin over a period of time, and your child is ready for discharge. Your child need a lifelong insulin injection, and our pediatrician or the nurses will teach you which site to get injection done and a frequent visit. How do you monitor the blood sugars level? So we have to accept that in type 1 insulin is the treatment, injection insulin is the treatment. So we don't have any other option. So I hope this information will be very helpful for you. If any further doubt, you can contact or comment in the comment section box. We'll have a detailed discussion about type 1 diabetes in children. Thank you. Until then, bye from Dr. Shashidharan.